love you like that. Taking care of yourself is the love no one else could ever give. Exercise and eating healthy, that's the best thing for your body. Smoking and drinking will not help. Sniffing and drugs, you'll hurt yourself. You gotta remember to check your blood pressure. You gotta take good care of yourself. Who's gonna love you like that? Taking care of yourself is the love no one else could ever give. Exercise and eating healthy, that's the best thing for your body.
Good evening, my viewing audience. I am Jeanita Richardson, Health Educator at the Health Promotion Unit, in with this week's edition of Health Matters. Today I have with me Dr. Richardson from the University of Virginia, and she and her team will be here doing some surveys and research on diabetes too. Thank you, Dr. Richardson, for being here.
Thank you for having me.
And could you tell us a little bit about your organization and what you guys do?
Sure. So I'm representing the University of Virginia and a team of researchers who are partnering with the Ministry of Health to investigate type 2 diabetes here in the Federation.
Okay. And how long have you guys been partnering with St. Kitts and Nevis?
We've actually been coming here and partnering with the Ministry of Health for 6 years now. We've had a couple classes, one on emergency preparedness, another on what we call social determinants of child health. And there have been a number of research projects that have been advanced collaboratively over those 6-year period, as well as someone's dissertation and different theses. So we've been partnering here for quite a while.
Okay. And why was St. Kitts and Nevis the Caribbean country of choice for this?
I'm really glad you asked that question because the grant that is funding this work includes a global focus. And so we weren't choosing just among Caribbean countries, but we were choosing countries everywhere in the world. And the 3 sites for this research that's funded by the National Institutes of Health are Uganda, South Africa, and now St. Kitts and Nevis. And so we purposely selected St. Kitts and Nevis because of our long relationship here with the Ministry of Health and our ability to be transparent and advance mutually beneficial projects.
Okay, that's good. And what other projects have you done here in the Federation?
So there have been quite a few. One study was a dissertation of a University of Virginia student who looked at practices in maternal health when young women are pregnant. We did a study on child asthma and what parents and clinicians know about how to manage children's asthma, which is a major health issue here in the Federation. We have developed some asthma education materials in collaboration with the Ministry of Health for children and have actually piloted those in a couple schools here in Tucker Clark and also in Ivor Walters. We have, actually there's a book now that's being edited about the long-term collaboration between the University of Virginia and St. Kitts, which we hope will be out and available by the end of the year.
Oh, that's good. Yeah. And these projects have been successful, you find?
Absolutely. We keep coming back, right? We keep coming back because the collaborations are rich and the people of St. Kitts and Nevis have been so welcoming, and the ministry and the University of Virginia are able to find common ground and projects that benefit both the Federation and the research agenda of the university. And so we're real excited to be here.
That's good. Yeah. So we're cooperative then?
That's right, very much so, very much so.
Okay, that's good. And how has the cooperation and feedback from your past projects here in the Federation been?
It's been wonderful. One of the reasons that when this new opportunity presented itself that I could advocate at my university that St. Kitts and Nevis be a site is precisely because of the ways in which we've been able to collaborate in the past. And So I teach classes on how to engage with partners around the world when one wants to conduct research, and all of the linchpins for successful collaborations are here. And they are transparency between your government and Ministry of Health and us, so everyone knows what's going on, we know who to talk to. A respect for each other's cultures and priorities, and then mutually identifying what the foci of the research should be. And so the selection of child asthma, for example, was not done in isolation. It was selected after consultation with Ministry of Health about what the priorities for child health were here in the Federation. Similarly, the selection of type 2 diabetes comes also from those kinds of conversations where we said, what are the priorities here? What are your concerns? And what data do you need to help support the health of the population of the Federation? And so it's being able to, in conversation with one another, come up with those that makes this site so attractive for us to continue.
Okay, that's good. I'm glad that Think It's Nevis is one of the target groups for this.
Yeah.
Let's talk a little bit about this project that you're here to do on this visit. What's the name of the project, and give us some insight on it?
Great. So the project is called Discovering the Prevalence and Distribution of Type 2 Diabetes in the Federation. What we're seeking to find are there what the population knows about what we in the research community understand are the risk factors for type 2 diabetes. The bad news is that there are many cases of type 2 diabetes here in the Federation, and increasingly being diagnosed in younger and younger persons. And so we need to do something about curbing that tide. The good news about type 2 diabetes is that it can be reversed.
Right.
And it is very much influenced by behavior and self-choices.
Right.
And so what we want to do with this survey is to ask members of the population what kind of diet do they eat, what exercises are they used to, how much vigorous exercise is associated with their work. Do they have high blood pressure? How are they managing it? What do they understand about cholesterol? And then when we collect all of this information, we'll be able to analyze it, give it back to the Ministry of Health. And what we know from the research is that when interventions and materials are developed based on what people already know, that it's more efficient, it's more effective, and it's also more cost effective.
Right.
And so this is a strategy that has been applied actually around the world in global research, and we're hoping that that target will be able to help the Ministry of Health here curb the tide of these increased cases of type 2 diabetes.
That should definitely help. We need help with that. And who funds and supports this project?
So this project this summer is funded by the National Institutes of Health through their Minority Health and Minority Health Disparities Unit. It is a 5-year grant that is focused on increasing the exposure of students of color, so Black, Hispanic, and Native American students, and their interest in doing global health research. And so it funds students to come to a country and conduct research, and hopefully with the idea that after their undergraduate education is completed, they'll go on to graduate education. What excites me about this opportunity is that because we are not doing lab research, we have extra resources in this grant. And so I jumped at the opportunity to collaborate with and to bring students onto our team that are local, because one of my agendas is to make sure that we're building local research capacity. So someday you won't need me and my team to come and to share expertise. You have it right here, and you have a lot of it. And so we have 2 students from Nevis Sixth Form who are joining our team, and we have 2 students from CFBC, a faculty member from each of those institutions, as well as 6 students from the United States who will all come together starting today and be trained to be able to administer these surveys.
And are they excited about it?
I think they're quite excited. I think you'd have to ask. I have my Nevis sixth form group over to the side, but they seem quite excited about it. Would you like to know their names? I'd love to share. And so what you should also know about the students that are a part of this project is that it was a very competitive process.
Okay.
And so the students had to submit an application with an explanation of why they wanted to participate in the project. And so I had a number of applications from Nevis sixth form, some from CFBC, and then in the United States it was a national competition. So it's quite competitive to be part of this project. And so the two students and faculty from Nevis sixth form are Noah Lisa Swabe and Ajari Brown, and their faculty mentor is Ms. Gail Mills.
Okay.
And then from CFBC, we have Michelle Crawford and Ahisha Herbert, and their faculty mentor is Dr. Marissa O'Connor, who actually is from Nevis but teaches at CFBC.
Oh yes, I know Marissa. Okay. And in terms of your team that came here with you from the university, could you talk a little bit about them and how were they chosen?
Sure. And so they also underwent a rigorous selection process. And so there was an application, their transcripts were sent. They also had to have an interview with the other principal investigators of the grants. And then from that pool, we selected the 6. There actually are 12 students. 6 are here in St. Kitts and Nevis. The other 6 are right now in South Africa conducting research. The other part that I'm really excited about is that we have, because this is the first year of the grant, resources to bring the entire team. So my Nevisian students and my Kittitian students, as well as their faculty mentors, back to the United States for our intense analysis week at the end of July.
Wow.
And so the entire team will be back at the University of Virginia. They'll be able to interact with the South Africa team and learn how to actually analyze the data that they've collected while they're here. It's a very exciting project.
That's exciting, and you get to travel too. That's good.
Yes,
Yeah,
you know, I
that's
always
advantageous.
jump at an opportunity to
Yes.
be in the Federation. Yes.
And then some of those other students from the U.S. that you just spoke of, they get to travel to South Africa. That's really good, right?
Oh, well, they don't get to travel to South Africa. The group that's in South Africa will meet us in Virginia.
In the U.S.
Yeah,
okay.
yeah.
Okay, got you.
Yeah.
And what is the research focus?
So the research focus is understanding what the general population understand about type 2 diabetes and the risk factors associated with the disease.
And why is type 2 diabetes the focus?
So type 2 diabetes is the focus because of its known prevalence in Afro-Caribbean populations. So that's not just here in the Federation, but that's in the United States and Africa. And so type 2 diabetes, we seem to have a genetic predisposition to it, but given our diets and exercise
Lifestyle.
patterns and
Right.
lifestyle choices, we're also seeing increased numbers of persons being diagnosed with this preventable and reversible disease. And the Ministry of Health has identified this as one of the #1 reasons for what we call morbidity and mortality. And so amputations and the cost to the healthcare system about managing insulin dependence and all of those sorts of things are really critical. And I can say also that for me, a focus on type 2 diabetes is really personal.
Okay.
Because a year ago yesterday, my father passed away from complications from type 2 diabetes. And so while intellectually and as a researcher, it's important to do, it's also quite personal for me.
Right.
Yeah.
And type 2 diabetes is also personal to me because I lost my grandmother to complications from that 2 years ago. Type 2 diabetes.
sorry,
And
yeah.
thank you. And we also do have a lot of type 2 diabetes on the island indeed. And working in health where I work, we see a lot of statistics from it. So it's actually something that needs to be dealt with as soon as possible. Combined with all the other NCDs we have, but still,
Right.
diabetes and hypertension are really high for such a small population. I'm sure you see that when you look at the statistics.
Yes,
'Cause
yes.
we have a small population, but it's like it's almost equal, right?
Yeah, there's what we call that a disproportionate
Right.
distribution of the disease based on the size of the population and how many cases you have. And then your hypertension and high cholesterol numbers are also related to
Yes.
diabetes. And so when you start talking about these chronic diseases going hand in hand, it's really critical that we take a comprehensive look at them.
Yeah.
Yeah.
And a lot of them could be avoided and
Yes.
even treated just by simple changes that we try to push these all the time.
Yeah,
It's
a little-
lifestyle,
yes.
eating the right thing,
Yes.
exercising often.
Yeah, yeah.
You know?
A little less KFC and Domino's.
Right.
Yeah.
Okay. So when will the study begin?
So we'll officially kick off on Monday,
Okay.
when the entire team of students will be here in Nevis.
Okay.
And so don't be surprised if you see young people in the square and in grocery store parking lots with the University of Virginia Global Health t-shirts. And we'll be asking people to just spend about 10 minutes to answer a few questions. There's no way that anyone could connect who an individual is
Okay.
to the answers that they give us. So the answers are absolutely confidential and will be compiled and reported out at an island level. And so there's no way anyone could know what person said what answer to the question. And students have all been trained in how to conduct ethical research.
Right.
And so that's where the students will be, and the faculty will be, hanging on the side and making sure that everything is going smoothly. And so we'll start then on Monday, and we'll be in country and conducting the surveys until July the 24th, when we then pack up and head back to the United States.
Okay. Okay, so you're gonna just break down and just give us a little more details about you're gonna be in the parking lot and they're gonna see what are they gonna see when they go
Okay, so when the next time you go to Best Buy,
Right.
so you might see in the parking lot a number of young people with a University of Virginia t-shirt on. They'll either be white or blue,
Okay.
and they'll have clipboards.
Okay.
And they'll come and they'll ask you, would you mind answering a few questions about type 2 diabetes?
Okay.
And if you say yes, we'll say thank you, and then we'll proceed to ask questions.
Okay.
And if you say no, we thank you very much for your time. The questions are very general about diet and lifestyle and exercise and whether someone is already diabetic or has hypertension. And then there are a few open questions about why do you think people have diabetes and do you think it can be managed?
Okay.
And then the students will say thank you very much and you'll be on your way.
Okay, good. That's pretty easy.
Yeah,
That's
pretty
easy.
easy.
You're not gonna know who your names are not
No.
gonna be taken.
No, we're not even taking names. All we'll be asking is, do you give permission to ask
Right.
us to ask you these questions? And most of them are multiple choice, and so
Okay.
it's real quick.
Okay.
And you can stop answering questions whenever you like. And if there's a question that you're asked and you don't feel comfortable answering it, you
That's
don't have to
fine.
answer it. It's fine.
Okay, that's good. Well, you kind of went over this, but let me just ask it again for reiteration. Why is it important for Federation citizens to participate in this survey?
So we know from the research that if we're going to create education materials and strategies to advance population health, we should not do so in a bubble.
Right.
We should not do so without talking to the very people that we want to help.
Right.
And so by participating in this survey, the citizens actually help the Ministry of Health help them, because there's no other way we're going to know what it is that you think, how you feel about your health, what sort of support you believe that you need. We can't do this without you. And so it helps not just the students who are learning how to conduct research, but it also will come back and benefit you as a participant when you begin to see how the Ministry of Health uses this data to promote a healthier lifestyle and ways in which you can stay healthy longer.
Right. Okay.
Yeah.
That's good. Those are some good reasons.
Yep. Yep.
Do you have any additional words you like to give? It could be advice or just anything you want to say.
So I just first of all want to say thank you for this opportunity to share, and thank the people of St. Kitts and Nevis who, in the 4 years that I have been coming, are a wonderful and welcoming and very well informed people,
Right.
and so me great hope that your participation in studies like this will turn over to benefit you tremendously. And thank you for welcoming the students here, because the students from the U.S. have already fallen in love with the Federation. I told them, you're going to fall in love, and they said, yeah, but they're here, and I'm going to have a hard time putting them on the plane to take them back. But we just want to thank you all for the participation, and I really do encourage you, if you see a student and you do have the time, we would most appreciate you participating in the study, because it helps the ministry, it helps the students, and it helps us as researchers.
Okay, that's good. And you want to thank any particular organization or institution?
Well, sure. Certainly we want to thank the National Institutes of Health for awarding the University of Virginia this prestigious grant that will support research for 5 years. I would like to thank the Honorable Wendy Phipps and the CMO, Dr. Martin, for welcoming us here, because we've been in conversation with them before we even developed the research plan to identify the priorities. And then I have to give a special thank you to Permanent Secretary Slack Liebert, who beyond this project has been an incredible colleague and helped educate me on the health systems here and how to conduct research here in St. Kitts and Nevis, because wherever you go in the world, the protocols and the proper way of engaging population is different.
Yes,
and she has taken great time with me to teach me the best way to conduct research here. And so I want to extend a special thank you to her.
Okay. Thanks. And Nevis is great as always?
And Nevis. Nevis is in my heart.
You've been to the beach?
Always.
Of course.
Always. My first stop, Owali.
Okay, well, that's good, Dr. Richardson. If you don't have any more words?
No.
Any more words? Okay. Well, we'd like to thank the general population for listening and viewing tonight's episode of Health Matters. I encourage everyone, if you see the University of the Virginia students in the parking lot anywhere, please cooperate and do the survey. It's to help everyone. We each one teach one, we're helping each other. And that has been this week's edition of Health Matters. I am your host, Jeanita Richardson, health educator at the Health Promotion Unit. I would like to thank Dr. Richardson, along with her team and the University of Virginia, for being here with me today and for doing the survey on the islands of St. Kitts and Nevis. The fruit of the week is gooseberry. Gooseberry is high in antioxidants as well as vitamin C. So if it's too sour to eat, you can make juice from it. Have some gooseberry this week.
Who's gonna love you like that? Taking care of yourself is a love no one else could ever give. Exercise and eating healthy, that's the best thing for your body. Smoking and drinking will not help. Sniffing and drugs, you'll hurt yourself. You gotta remember to check your blood pressure. You gotta take good care of yourself. Who's gonna love you like that? Taking care of yourself is a love no one else could ever give. Exercise